we have all seen examples of some who continue to defy orders and instruction, whether that is hoarding important medical supplies and goods or coming together in large groups. It has become clear that additional extraordinary measures are necessary to secure critical supply chains and safeguard the most vulnerable. I want to be clear, as the Premier just said a moment ago, Dr. Henry's orders are not suggestions or good advice, they are the law. And as Minister of Public Safety, I will exercise my powers under the Emergency Program Act to ensure that those laws are enforced. That is why, today, based on the recommendation of BC's health and emergency management officials, I am taking the unprecedented step to issue a series of orders for the duration of this provincial state of emergency to support our provincial health officer and Minister of Health in our swift and powerful response to the COVID-19 pandemic. It's crucial that response and recovery is coordinated and that we move forward in lockstep with federal and local governments under a single action plan. I know many British Columbians are worried about our flow of essential goods and our ability to ensure shelves are stocked. Therefore, effective immediately, we have established a new provincial supply chain coordination unit to work in partnership with industry to coordinate goods and services distribution. And any bylaws that restrict the delivery of goods at any time of day are repealed. The province, through Emergency Management BC, will take a more active role in coordinating essential goods and services movement by land, air, marine, and rail. And at EMBC's request, retailers and suppliers must report on inventory of critical supplies, including health supplies for frontline workers. To protect British Columbians and give everyone the peace of mind that they will be able to buy groceries and other essential supplies, we are prohibiting the resale of food, medical supplies, personal protective equipment, cleaning, and other essential supplies, and working with retailers on measures to restrict quantities of certain essential products at the point of sale. These measures will help end hoarding at our grocery stores and the shameful black market for medical supplies, making sure our essential service workers, including health workers, have every resource available that they need to continue with their incredible efforts in caring for all of us. We are at a critical stage in our response to COVID-19. The message from health officials is clear and simple. How we act today will determine our future. Most people are doing the right thing, staying home, staying physically distant, and adjusting to life at the direction of our provincial health officer. As I said again, and I'll remind everyone, Dr. Henry's orders aren't suggestions, they are the law. To that end, we will be enabling municipal bylaw officers to be redeployed to help ensure compliance with the provincial health officer's recommendations and orders which could carry fines or even jail time. The PHO's recommendations and orders include physical distancing, making sure that businesses ordered to close are staying closed, and that gatherings of more than 50 people don't take place. I want to commend the passion and dedication of our frontline workers working to fight COVID-19 and keep people safe. And I also acknowledge the steps many communities have already taken to respond to this health crisis. Many local governments have declared local states of emergency in an effort to combat this pandemic on the front lines. But in these unprecedented times, it's more important than ever to coordinate emergency response to better serve and protect British Columbians. Effective immediately, municipal states of emergency related to COVID-19 are suspended. This will ensure a coordinated approach is taken under the provincially declared state of emergency. Local governments are key partners. To that end, local governments are being asked to identify and make available any publicly owned facility that may be used for pandemic response, including facilities for self-isolation, medical care, and testing. that they must respond to any requests for information from the province to identify resources and critical supply and service needs. This is not an exhaustive list, and more information on these measures will be available in the coming days and weeks ahead. I'd like to take a minute to acknowledge the many people adapting at work and at home to the new environment under COVID-19. All those people working in essential services to keep society running, thank you. If you're adapting your business and finding ways to work from home, it's important that you continue to do so. In fact, it's crucial. Every day you log in from home, you're doing your part to keep your community healthy and safe. These are unprecedented measures for unprecedented times, and these are actions I would not be taking unless absolutely necessary. Our frontline workers are supporting all of us through this health emergency. The rest of us need to do our part by supporting them. As the Premier said, they've had our back. It's time that we have theirs. And we can and we will by following the Provincial Health Office's orders, staying home and keeping our essential goods and services flowing. Now is the time for all of us to be kind, to be calm, and to be safe. But it's also a time to be selfless, to know the decisions you make today could drastically impact the lives of your family, friends, and neighbors. So I want to close by saying, follow the advice of the public health officer. Be vigilant about your hand hygiene. Maintain physical distancing. Do not leave home if you're sick. And remember, public safety orders in place from the provincial health officer and the province must be followed. Failure to do so will have real consequences for all of us. Thank you.